It's yes. It's a bit of technical hitches back and forth, but we are trying the much we can before we can let Dr. Patney go. Our viewers, just let us know if it's hanging somewhere so that we see what to do. But at least this is the last trial we are trying, and then see how best we can do it. Dr. Patney, can you just say a little bit about yourself?
Yes, thank you, and thank you those for tuning in. My name is Pashi Håkonal Niskaturivi. I'm a specialist in obstetrics. I work as a doctor. My day job, I look after women who are pregnant, after them when they're giving birth. That's my day job, not vitamin D. I've lived in Norway for nearly 20 years, and I have a wife and two elderly teenagers.
Okay, thank you. We are talking about vitamin D deficiency, winter, and everything when it comes to COVID-19. Could you talk about vitamin D and vitamin D deficiency just a little bit?
Okay, I'll try and make it short. But okay, vitamin D is basically that we have in our bodies, whose job it is to make sure that we absorb enough calcium from our digestive system, and that it's available in our bloodstream. We think about calcium in terms of bones and what have you. But calcium on a day-to-day basis is an essential requirement for the normal functioning of pretty much all the cells in our body. Everything from the communication between nerve cells, the normal functioning of muscle cells, and also the normal healthy functioning of our immune system. So without the availability of calcium in our blood, it wouldn't function. So that's what vitamin D is there to ensure, that we get enough from our diet. If we don't get enough from our diet because it's not in our diet, or we have enough vitamin D, then our bodies will start to hack into the calcium stores in our bones. And if that goes on for long enough, we'll get weak bones, which in old people results in fractures, and in children growing up, they end up with bendy legs. That is from the past. So we need vitamin D to get calcium into our bodies and available for our bodies. Deficiency, well, vitamin D is made by our bodies. It's not something that we normally are dependent on our diet, although we need some in our diet when we can't make it ourselves, and we make it on the surface of our skins. And it's basically the cholesterol we have in our body. We need only small amounts. The energy from the UV light rays converts this cholesterol into vitamin D, which we can then store in our own fat stores, and makes a useful store to last for a long period of time. The active part of vitamin D, once produced in the skin, the active part comes from being processed through liver and then through kidneys before it's the active part. So somebody will develop, there's quite a lot of interference in the background. You can hear people in the background, sorry.
Yeah, a little bit. Okay. Yeah, a little bit of interference. Let me switch off my microphone, but just continue, so okay.
Yeah, vitamin D deficiency is when one doesn't have enough vitamin D in the system, and that's because one hasn't got enough in our own stores. We're not made enough from the sun. That may be because there's not enough sunlight. Now, if we all live around the equator, there'll be no limit to the amount of the sun that's available. But the further we live from the equator, like we do in Scandinavia or in North America, there's a limit to the amount of the sun with the intensity that's required to produce vitamin D from the skin. Another thing is that if you have dark pigmented skin, that will also reduce the efficiency of the skin with the same sun exposure, it won't produce as much vitamin D. So when the sun is weak, the lighter, the darker the skin, the longer you need to be in the sun, and that's not always possible. When it comes also to, so if you have dark or if you have old skin. So when I'm 75, my skin will only produce about a quarter of the amount of vitamin D that it did from the same sun exposure when it was 20 years old. So old people also are more prone to developing vitamin D deficiency, lack of exposure to sun. Also, if we sit indoors all day, we don't get to the sun. And then in terms of the diet, either somebody doesn't have a diet which contains an adequate amount of vitamin D available, or their intestines don't have a problem which doesn't allow them to absorb vitamin D. So even if it's available diet, there's not enough being taken into the system. And there's some people with chronic inflammatory bowel diseases which will have a problem with absorbing enough vitamin D. Everybody is basically at risk of developing vitamin D deficiency if they haven't had enough sun exposure in the summer, and they get winter where there's basically no sun. They begin to tap into that's available in their bodies. If they don't have enough, they're going to go. Yeah.
Okay. Thank
there are
you.
also some.
How is what?
Drugs.
Just continue.
Okay. Sorry, there's a little bit
Just
delay.
continue.
No. I was also going to say there are also some types of drugs, particularly HIV drugs, drugs used for treating tuberculosis, which can also reduce the amount of vitamin D that's absorbed by a person.
Okay. Thank you. When it comes to the essentials of vitamin, you've talked about the different categories of people who can be vulnerable. That was good. You've mentioned that. But what are the essentials of vitamin D in the body? Essentials of vitamin
kind of
D.
Mentioned them. Yeah. Okay. Yeah. I've in a sense mentioned that we produce the vitamin D from our skin, then it is stored in our fat stores, and when it's required, the active vitamin is actually produced first by the stored the vitamin D from the skin going through the liver, a process in the liver, then a process in the kidneys. Then you've got the active vitamin D. So if you have a chronic liver condition, if you have kidneys which are functioning well, then that may also predispose you to a vitamin deficiency. Yeah.
Okay, thank you. How is vitamin D? Yeah, vitamin D. How is it correlated to COVID-19? And now that we are in winter, could you say something about it?
Okay. Well, as I mentioned before, this will change throughout the year. In the summer, they'll be at their highest, and they'll be at their lowest levels around about the end of winter. Getting enough sun exposure, and I'm dependent on, in a sense, filling up daily on dietary intake of vitamin D. One thing is that often this peak and trough of vitamin D levels correlates well with respiratory tract infections. They often occur also during the winter months. That's not necessarily it's an association. One thing that indeed has been shown to, if you take it as a supplement, or you have a normal vitamin D level, have vitamin D levels and take supplements and to reach normal vitamin D levels, that's been shown in studies to increase resilience, respiratory tract infections. So I'm talking now about addressing one's vitamin D intake and having a knowledge about whether one might be deficient, and addressing that already now, because if you begin to fill up, then evidence seems to suggest that it will have less of a risk of developing respiratory tract infection this winter. And why is this winter in particular of interest? Well, this is the winter where we're going into also potentially another spike in corona infections, which we're already seeing the signs of this autumn. There's no evidence to show that vitamin D will protect against coronavirus as in COVID-19. But as I said, coronavirus is one of many viruses that infect through the respiratory tract. If the body is more resilient to this attack, then it may be that corona also is easily to hold in our bodies if we have adequate vitamin D levels. This is not proven, but there is a randomized controlled trial which is ongoing now in the UK. It's been started by professors at the Queen Mary University in London, where they're looking at giving people relatively high supplements as opposed to just the normal recommended daily supplements of vitamin D.
Thank you.
So, yeah.
Yeah. Could you advise people to go for vitamin D right now, and especially during this winter? Any advice?
Well, yes, I think aside from corona, just taking corona to one side, the winter is the time when we have our lowest vitamin D levels. Low vitamin D levels are associated with health. And we know also that bringing the vitamin D levels up will reduce the risk of respiratory tract infection. So addressing vitamin D level now may lead to a healthier winter. And I think there's nothing really to lose, because if it does show to be affected by vitamin D levels, then all the better. Also, being healthier this winter, when we see an extra burden on our health services, will be an indirect benefit on for our population if we're all in general. And I think if you as an individual identify yourself as perhaps being someone, we don't know usually our own vitals, but thinking about how much sun exposure one has, thinking about the pigment of one's skin, how old one is, suspects that one may be vitamin D deficient. There's nothing wrong in asking your GP if they can measure your levels. In years ago, there was a publication by experts commissioned by the Health Directorate, where experts maintained a need for the population to address its vitamin D intake. And their recommendations were 10 micrograms is what people should be taking daily if they're not getting enough sun exposure in the summertime. And the groups in particular that they said take vitamin D all year round, either in dietary form or a supplement, were people with brown skin or with migrant background, and people who were over 70, 75 years old. They also showed that teenagers in Norway also have a high prevalence of vitamin D deficiency. So I would say that taking enough vitamin D, according to the recommendations, which is 10 to 15 micrograms for a normal adult, is absolutely and is only beneficial. And if you think that you might be vitamin D deficient, either because you have the vague symptoms of headache and aches and pains in your joints, maybe excessive lethargy, which may have many different causes. But if you go to your GP and they're going to check your hemoglobin and your thyroid function, then you can ask them, could you please check your vitamin D levels? If you're shown to be vitamin D deficient, then they will provide you with an higher vitamin D supplementation, which will be up to 80 micrograms daily for a period of time, and they will check your levels to see if your deficient level has risen.
Okay, thank you. As you'll be mentioning this one on the recommended diet for vitamin D, probably explain a little bit why a youth or a teenager is prone to this. Thank you.
Oh, yeah. Oh, right. Okay. Yes, because I didn't mention the types of food which would be rich in vitamin D, because I don't think much, and many people may also not be quite aware of the types of foods which are rich in vitamin D. So I'll mention a few. The best supplement, natural supplement of vitamin D would be eating cod liver oil, and that's part of the Norwegian tradition, which is why I think we've always thought in Norway that that everybody has a normal vitamin D level, because everybody eats or drinks tran in the winter. But with modern lifestyles and modern appetites and diets, that's perhaps falling a little bit more out of fashion. And particularly young people, maybe people with a background have this tradition reinforced from an early age, are not taking adequate amounts of cod liver oil. So cod liver oil I can absolutely recommend, and take a tablespoon a day, or taking 2 or 3 capsules would be absolutely fine for a normal adult. And if you're elderly, then you probably need to take maybe double that amount. After that, you're looking at things like mushrooms, eating regularly 2-3 times a week, these oily fish like salmon, 100 milligrams of salmon will give you your daily requirement of vitamin D. Then we're on to things like fish, liver pate, eggs, butter. These are the sort of foodstuffs which contain a decent amount of vitamin D. But if you don't have this, or you don't feel that every day you've taken enough, then also taking a supplement either as cod liver oil or tran, or as the more synthetically produced versions, then you may do that. And then they have various tablets with 10 micrograms or 20 micrograms, and this is far below a dangerous dose. You have to be taking over 100 micrograms daily for there to show signs of overdose.
Thank you. Okay, thank you.
And so you asked why
it's still a bit up and down, but
why would
yeah, teenagers.
Sorry. Yeah, I suppose
the teenagers,
it's difficult for me to say why. Yes, teenagers are also shown to be a group where there's a higher prevalence of low vitamin D levels, and I can't explain the reason for that, but it's just show that it's not always the usual suspects that have low vitamin D levels, as old people or brown people, but also young people who are sitting a lot indoors, who have a modern diet which doesn't contain these foods which are rich in vitamin D. So the point is that one should assess one's own vitamin D intake and address that, and then see if one needs to take some natural form of supplement, or check one's levels and take a higher supplement by one's.
Okay. So yeah, as you close, do you have any final words for our viewers and listeners concerning vitamin D, coronavirus, and then winter? Just 1 minute here.
I think when it comes to coronavirus, I would follow all the recommendations made by our government, with distancing and wearing masks in public, and reducing the number of people one is in contact with. The whole point of vitamin D is not the only thing that's going to help. We don't even know if it helps, but normal vitamin D levels are associated with health. So if we can maintain vitamin D better. And I think this is a good year for people. And now we have, this is actually Black History Month in Norway. And if this becomes a tradition, then it may be worth remembering. You've got 2 months, the month to remember or to think about one's vitamin D intake, and use brain to whether one needs to take one's diet or check one's levels or take a little bit more supplement in the form of cod liver oil or synthetic. And tell as to these randomized control studies in the UK as to whether vitamin D indeed has the same protective effect against coronavirus as it does against other respiratory tract infections.
Thank you. Thank you, Dr. Patney, for your patience and with all the technical issues and everything. Thank you for being patient with us. And our viewers, we are sorry for today for the technical issues, but we promise to be much better. But I hope the information is out and someone is getting help. If you have any question, just be in touch with us, and we are always there for you. Thank you and have a nice day. Bye.